Good morning, ladies and gentlemen, doctors, practitioners in the field of healthcare. Thank you very much for inviting me for this very honorable meeting. And I'm very happy that I'm in the very hot land of medicine. This is the country of India. And there is so much to learn from this conference, and I really appreciate of being here. And I see the commitment of the people of India, including public and private. They're really willing to improve the healthcare system. And let me correct my status. I'm a Vice Minister of Health, not a Minister of Health of Mongolia. And we do have one minister and one Vice Minister in our country. But thank you very much for the promotion. Thank you. So to start with, I would like to introduce about this general healthcare system we have in Mongolia. We inherited this system from the times when the Soviets had a very strong influence in our country, and we had the system in the last 90 years. And there are many good and bad sides of the system, but so far we have only 3 million people in our country. It's a very small populated country, but the challenges we have is the distance, because Mongolia has this very vast piece of land, and this is one of the scarcest populated countries in the world. And we spend about 3.6% of our GDPs for healthcare. We are proud that we have over 97% coverage of immunization, and our IMR stands somewhere around 15 to 18 per, I think, 1,000 live births, right? And we have a very good statistics showing that we have decrease of MMR. We had about 200 points per 100,000 per population in about 20 years ago, and we have about 42 last year. And I think it's a very good progress, and it has been exemplary in the region we live. And our life expectancy is growing each year. And to mention, we had the 17% decrease in the infectious disease in only last 2 years. And I think we had this achievement due to introduction of hepatitis A vaccine, which was a dominant cause of communicable diseases in our country. And we are going to introduce pneumococcal vaccine in the next 2 years. And that's going to be a nationwide vaccination that is one of the best in the region too. And I'm very proud of that. And also we will introduce this HPV, human papillomavirus vaccine on a voluntary basis in the next coming years. And I sometimes wonder why India has this low rate of vaccination, as many of you discussed in the yesterday, because India is one of the main producers of vaccines. And I think there is a controversy and discrepancy in that. I think there's more commitment needed for the government of India to tackle this issue. On the field of human resource, we have a problem in this quality of our doctors. We had a problem like India in the past. We didn't have enough doctors to work in the rural part of Mongolia. But that has ended with introducing a policy of having a 2-year of practice after graduation in the primary care of the rural and urban primary healthcare sectors. And I think that was a very good decision by the government of Mongolia. And maybe I think it could be a good example to introduce in other countries as well. But the problem is the quality of doctors, because as soon as you send the doctors who just graduated from the medical school, they don't have enough practice, and there is somebody has to be in charge for them and teach them and, you know, guide them. We have too many doctors in our country because a doctor is a very popular profession in our country. So every family wants to have one doctor in their family, and that's that's the problem we have. And we have too many doctors and too many medical schools. We have over 10 medical schools who like graduate about between 100 to 500 medical doctors per year, and that is too much for a country of a population of 3 million like ours. So we are interested in reducing the number of doctors and while improving the quality of them. So our policy was to, you know, reform this licensing program we have. So we changed the licensing test pool, which was only about 1,000 test pool. We changed it to 10,000, which is 10 times harder. And it ended up that we had only 3 doctors who could get to it out of 200 doctors in the last month, you know. So it's quite steep, but I think we will get to that point that we will have very good doctors. And you know, India has a very good and skilled doctors, but I think for India, you have a problem of brain draining to other countries. While you are in shortage of doctors in your own country, you are one of the biggest exporters of doctors in the world. And that's something that the government has to make point, and I think you'll have some progress in the future, I hope. For insurance policies, we have a very good coverage. It's about 90-something-7% coverage, but the package itself is not very good. And that's why about 40%, 41% of total healthcare expenditure is out of pocket of our patients. And that's not a good thing. And also we have one problem in our insurance policy, that is discrimination of public and private organizations. Let's say one procedure costs about $10 US. You will pay $10 US to public hospitals, but you will pay about $5 US to private hospitals for the same procedure. And that's what we're going to change. And we have a draft law on insurance, and we are tackling this problem and many other problems at the same time. One of the biggest problems we have in our country is this draining of our patients abroad. You know, Mongolia has been one of the fastest growing economies in the world in 2012. And you know, while the economy is growing in a very fast rate, we have this developing medical tourism that's going abroad from Mongolia to other countries, including Korea, China, and also India. And it has become a very attractive spot for foreign hospitals to attract. And we have so many, how to say, those branches of different hospitals from abroad. And I think we will have to somehow address this issue. And Mongolian government is going to have a bidding of technology and skills transfer. We will fund about $5 to $7 million US to transfer the skills so that our country doesn't have to rely and have our patients going abroad. For a small country as Mongolia, I think it's impossible to, you know, import all the skills or acquire all the skills in the field of medicine. But we want to have not all, but most of the important skills that we require in our country. Another issue we have is emergency service, and we have a waiting time of 40% for the waiting time of 20 minutes, where 40% of our emergencies come to the point within 20 minutes. And that is something we have to improve in the next coming years. NCDs is one of the burdens and top 4 cause of mortalities in our country. Number 1 killer is the cardiovascular disease, number 2 is cancer, and 3rd and 4th place comes to injuries and other causes of mortality. In IT sector, we are trying to develop a one whole system that would enable us to increase, enable our patients and also doctors to have access to patients' healthcare histories, and we're working on that. And I think we're happy to work on it from the beginning, because not many hospitals has these IT systems in place. So we can tackle this issue. We can have a common system in our country of 3 million of population. And I think that's one of the advantages of doing this. We have our healthcare partners phasing out of our country because the economy is growing, and this is one of the very big issues we face with these years. And I would like to thank our Indian partners for organizing this very exemplary meeting, and there are so many important partners from all sectors of the healthcare, and I wish we could organize this kind of meeting in our country as well. And my thanks to Dr. Reddy and other people who organized this, and also I would like to thank many hospitals and doctors who saved many lives of our Mongolian citizens in the past, and I hope and looking forward to a collaboration in the future. Thank you very much.